second video clip. Okay, so we are going to talk about the chapter 6 and chapter 7 reading to learn question. So in the chapter 6 question, okay, we are talking about the lactose intolerance. So in this question, I want you to know that I will remind you again, the prefix LACT, okay, is about milk. Okay, so lactose is the sugar in the milk, and lactase, okay, is the enzyme, okay, which is speeding up the breakdown of lactose. Okay, and also we shall learn more words about the milk, for example lactic acid or the lactation, okay, something like that. So LACT is about milk. Okay, so in this question, what you are going to do is that you need to remind yourself, okay, the composition of the disaccharide, monosaccharide, disaccharide. Okay, and in this question we do not talk about polysaccharide, but at least you know that, okay, there are 3 types of sugar, okay, mono, di, and polysaccharide. And then the first point and second point, okay, they are correlated because you need to point out the importance of digestion. Why do we need to break down the complex large food molecules into small simple food molecules? Okay, and the last part, the last question, you need to think, you need to relate your concept together. So how can you link diarrhea, osmosis, and water absorption, okay, all together to explain, okay, the phenomenon, okay, that the lactose intolerance patient, okay, why they may have diarrhea after drinking milk. Okay, so question 4 is mainly about the last part. Okay, you need to link all the concepts together. So first question, quite simple. Okay, what is the digested products of lactose, okay, under action of lactase? So the digestion concept. So, and then the second one, okay, why does our small intestine absorb sugars such as glucose and fructose? Okay, fructose is the sugar in the fruit, okay, fructose, but not lactose. So you need to recall, okay, the first and the second concept, okay, disaccharide, monosaccharide, okay, and then why do we need to break it down, okay, into small size, okay, and then the third one, okay, the activity of lactase is the highest before weaning. Okay, weaning, that means we stop, okay, feeding on milk. Okay, we stop feeding on milk. Okay, so before that, the activity of lactase is the highest, and so that means after weaning, okay, the activity of lactase, okay, becomes lower and lower. Okay, but the point is that why it is the highest, okay, before weaning. What is the significance of this? Okay, so let's take a look at the information we have. So lactose is a sugar in the milk. Okay, so it's small intestine. Okay, we have the lactase to digest lactose. Okay, and production of lactose, okay, lactase is controlled by genes. Okay, so we shall learn some genetic disease, okay, later on, to talk about if there is any defect, okay, in the genes, okay, disorder. So how can it affect, okay, the production of the lactase? Okay, this kind of is a enzyme. Okay, recall the concept. The gene, the DNA, the nucleus, okay, is responsible for controlling our cell activity. Okay, and one of the activities is the protein synthesis. And then, okay, and then go back to the information. The activity of these genes is the highest when we are born. Okay, so at this time, I want you to think about this question first. Very simple question. What do the newborn mammals feed on? Okay, it must be milk, right? Okay, otherwise we cannot be regarded as mammals. Okay, and then the production of lactase decreases gradually after weaning. Okay, after we stop feeding on milk, okay, and then the production of lactase will become lower and lower. Okay, but the point is that, okay, will you suffer from diarrhea after drinking milk? Okay, as I asked in the class, okay, most of us, okay, did not experience this diarrhea, this case, but some of them, okay, they may cannot, okay, they may be not able to produce lactase. So lactase production reduces to a very low level or even stops when they reach adulthood. Okay, so the point is that some people, they may not be able to produce lactase, okay, but some of them, okay, can keep producing lactase. Okay, so that's the concept is not none or all, or all or none. Okay, probably that's a scale from maybe from 0 to 100. Okay, how many lactase can you produce? Okay, some may be 99, but some may be only 10, 5, something like that. Okay, or most likely maybe some just for 50, 60, 70, something like that. Okay, so this is not all or none. Okay, and the lactose intolerance, okay, refers to the condition of having insufficient level of lactase. So that's why, okay, probably those patients, they cannot digest the lactase properly, completely. Okay, so in this box you can see that lactose is broken down by the lactase, okay, and form glucose and galactose. Galactose, okay, is a simple sugar. Okay, so in this box I want you to distinguish, okay, which one is monosaccharide and which one is disaccharide. You need to tell me. Okay, and then we go back to the concept. Okay, for the patients who is suffering from the lactose intolerance, okay, they do not have enough lactase. So the point is that the digestion of lactase, okay, cannot be complete. Okay, and since, okay, the lactose cannot be digested, so they cannot be absorbed, okay, and they cannot be assimilated, okay, uptake and use as well, right? So the final destination will be ejection. Okay, will be ejection. But the point is that why will they suffer from diarrhea? Okay, so in this box, okay, you need to know that the lactose cannot be digested and will pass to the large intestine, the colon. Okay, and in the colon, okay, there are some bacteria, they will metabolize the lactose to form some gases, okay, and make you feel uncomfortable. Okay, but that's not the focus in for the question. Okay, I want you to know that is that why the lactose intolerance will lead to diarrhea. So increase the concentration of lactose and the metabolic products of the bacteria, okay, may result in diarrhea. Why? So for this flow chart, okay, I want to give you some hints. Lactose intolerance refers to that the patient, okay, cannot produce sufficient amount of lactase, so that's why the lactose cannot be digested and absorbed. Okay, and also the bacteria can use, okay, the lactose in our large intestine, okay, to produce some metabolic products. Okay, so the point is that increase the concentration of lactose and metabolic products, okay, of the bacteria. So this part, okay, for the green box, okay, is not related to the question. Okay, I just give you some information, okay, supplement information, because in the paragraph, okay, it just mentioned the gas. Okay, but what is the gas? If you are interested, so you can see that the metabolic waste produced by the bacteria contain hydrogen, carbon dioxide, and methane. Okay, so that's the gas. Okay, but our focus is diarrhea. Okay, is diarrhea. So you need to link is that you need to think is why increase the concentration of lactose. Let's focus the concept on the increase the concentration of lactose first. Okay, lactose is water soluble, and then if the concentration of lactose in your colon is very high, so how does it affect the water potential, okay, of the content in your colon? Okay, and after you can answer this question, okay, when the concentration of sugar is higher, so what will be the water potential of content in the colon? Okay, maybe higher, maybe lower, you answer me. Okay, so if you have this answer, you can think about, can the large intestine perform its function well? Okay, so what is the main function of the large intestine? Okay, so it probably, okay, if you can remember that, okay, the large intestine is responsible for absorbing remaining water from the small intestine, okay, or from the feces, I mean, okay. That means because the small intestine, okay, the small intestine absorb most water in the digested food, okay, and the undigested food, okay, will pass to the colon, okay, to the large intestine, okay, and for the large intestine, okay, it will absorb the remaining water from the undigested food, okay, from the feces. So any function, okay, they can perform well, okay, or not. So that's the key point, okay, for the diarrhea. And the last paragraph is that, how can we make the lactose intolerance patient, okay, if they really want to enjoy the dairy product, because you know that dairy products is a good source of calcium, okay. So how can they intake those calcium, okay, but will not suffer from the diarrhea, okay. So one simple idea is that give them the calcium supplement, the pills, right, okay. But if they really want to drink milk, okay, you can see that, refer to the picture, okay, there is the enzyme, okay, added to the milk. So that means, okay, the lactase is already added to the milk to break down the lactose, okay. So the lactose content, okay, will be very, very low in the milk, okay. So even the lactose intolerance patient drink this milk, okay, they will not suffer from diarrhea at all, okay. So that's the concept of chapter 6. Let's move on to chapter 7. Chapter 7 is about asthma. So in this question, what you are going to recall, the concept is that describe the airflow in the respiratory system from the atmosphere to the nasal cavity, to the pharynx, to the nares, to the trachea, something like that, okay. To the flow chart, okay, you need to remind yourself. And the second one is that recall the structures, okay, in the respiratory tract, okay, and also the function, okay. So in this question, the structure, okay, we focus on is the bronchiole, okay. And also you need to identify the risk factors of an asthma attack. And the last part is that analyze how the drugs, okay, can be used to treat the patient. So for the first question, explain why the patients have breathing difficulties during an asthma attack, okay. It's just like the question, okay, we talk about in the assignment, okay. So you can see that from the picture, okay. The airway, okay, the bronchiole dilates, okay, dilates as usual, okay, as normal. And during the asthma attack, okay, the bronchiole constrict, okay. So why there will be a breathing difficulties, okay, why? No matter breathing in and out, okay, I need to know why there is a breathing difficulty. And the second question is that suggest 2 ways to reduce the risk of an asthma attack, okay. From the paragraph, you can find the solution, okay. You can find any suggestions, okay. And the third one is that suggest one advantage of taking asthma drugs through inhalation rather than orally, taking the drugs orally, okay. So that's the last part. You need to think of why, okay, these drugs you need to use in this way, and for another drugs, okay, you need to use it in that way, okay. So you need to distinguish, okay, different drugs, okay. You may intake the drugs, okay, differently. So for the first paragraph, okay, it's talking about the disease, okay. Asthma is the inflammatory disease. Inflammatory, that means is related to the information, okay. Information, that means something, okay, irritates your immune system, okay. And then, okay, this will trigger the inflammation in your body, okay. And this time, okay, is in your bronchiole. So during an asthma attack, okay, the bronchiole constrict just like this picture, okay, dilate as normal, okay. But the point is that it will constrict, okay, during asthma attack. And also the lining of the bronchiole swells, okay, and the mucus secretion increases. So you can see that, okay. What is the effect, okay? What is the effect of the constriction of the bronchiole and the excessive mucus secretion and the swelling of the bronchiole, okay, will exert on the airway, Okay, will it become wider or narrower? Okay, and why? Okay, and also what is the effect of the mucus, okay, in the bronchiole? So you need to focus is that the airway, okay, the lumen, the size of the airway. Okay, so and the second paragraph is that, okay, there is a list of the risk factor, okay, of causing asthma. So in this question, okay, like you know that is a list, okay, about the possible cause, okay, of asthma, but okay, in the question, okay, you are asked to suggest any method, okay, to reduce the risk of the asthma attack. So you need to reverse, okay, think. Okay, it is a reverse thinking question. It's very common in biology examination because, okay, for example, I use obesity, okay, as an example. Probably, okay, there is one kind of question to ask you why the people they become obese. Okay, so you list out the reason, or taking too much fat, okay, they do not do regular exercise, and then the energy intake will be much higher than the energy output, okay, and then they become fatter and fatter because the energy intake, okay, will be stored, okay, in the body, okay, in form of the maybe carbohydrate, in form of the fat, something like that. Okay, but we have the other way, to think about this question. Okay, so I give you the case of someone is obese now. Okay, so any method to help him, okay, or her to become slimmer again, okay, to lose some weight, or any method, okay, to suggest the people, okay, having a healthy lifestyle and prevent from being obese. Okay, so probably the answer will be, okay, reduce the intake of fat, okay, do some exercise, something like that. Okay, probably it's just a reverse thinking. Okay, for the first part, okay, first type of question, you point out that, oh, they intake so much fat. Okay, and any recommendation for them, okay, reverse thinking, or intake less fat, okay, in the diet, okay, having a balanced diet, something like that. So in biology, okay, reverse thinking is very, very important, okay, because it can check your concept, okay, indirectly. Okay, so for the second part is that the drugs, okay, how can we intake the drugs? Okay, the drugs, okay, can be taken to relieve the syndrome of the asthma because, okay, they are delivered to the lungs by the inhaler. Okay, and then the drugs can quickly relax the muscle in the wall of the bronchiole, okay, so that the bronchiole dilate, just like in these pictures. Okay, you know that normally, okay, the bronchiole, okay, the lumen is that wide, but once the during the asthma attack, okay, the bronchiole constrict, become like this, and after we intake the drugs, okay, the bronchiole will dilate again. Okay, so it can make the patient breathe more easily. So according to this information, okay, I want you to point out that, so taking the drugs by the inhaler or orally, which way, okay, can make sure that the drugs to reach the target organ as soon as possible. So in this case, okay, in the asthma, what is the target organ, okay, we want the drugs to go to? Okay, at least you need to answer me this question first. Okay, if you can point out what is the target organ, okay, so you can tell me that, oh, by taking the drugs by the inhaler or taking the drugs orally, okay, which way can make the effect of the drugs much faster? Okay, which way, okay, can ensure that, oh, we only use a smaller dose of the drugs, okay, and then, okay, which way can make less drugs reaching the other organs, the non-target organs, okay, of the body? Because the point is that the drugs, okay, we just want them to go to that particular organs, okay, to treat the patient, okay. Probably we do not want the drugs, okay, to go to another organs, okay, because they are not our target, right? So what you need to think, okay, these three short question, okay, but the main question you need to tell me first, which way can make sure that the drugs to reach the target organ as soon as possible. Okay, and then answer these 3 short questions. Okay, and I want to tell you that is that similar question, okay, will also appear, okay, in other chapter. For example, the hormone drugs, okay, such as insulin to control the diabetes. Okay, the diabetic patient, they cannot produce insulin by themselves. Okay, so just part of them, okay, part of the diabetic patient, they cannot produce insulin. So the method is that how can we, okay, give them some insulin, okay, just some hormone replacement treatment. Okay, so the point is that, so should we take the insulin, okay, take these drugs by injection, okay, to the blood directly, okay, blood injection, or by injection, okay, eat them, okay, put it orally, okay, intake the drugs orally, okay, or inject to the blood directly. So the point is that for other drugs, okay, we also need to think how can we use the drugs, the function of the drugs, the function of the hormones, the function of the enzyme. They can also be taught in the textbook. But okay, what you need to think, what you need to apply is that how can we make use of these drugs to treat the patients. Okay, so if you have any questions, so please leave your message, okay, in the message box below.